Hi, my name is Pam Sargent. I'm a Burst Ambassador since January 2020, one of 6 trainers in the U.S. for EMS on the Airflow Prophylaxis Master System, and I've been practicing dental hygiene for 20 years. I live in Searsmont, Maine, and I just recently opened up my own awesome independent practice. Currently, there are 3 states that allow hygienists to work independently, meaning they don't need to work in a private office or for a dentist. We can actually have our own office, work for ourselves, and that's exactly what I did. There's a thriving Amish community about 20 miles away, and they build these backyard buildings. This building is 12 by 20 with an 8-foot porch, and it came fully insulated, wired, and floor was installed. We put this wall in, and I built this barn door myself. It separates the lab space from the treatment area. Let me show you around my office and share some of my favorite tools that made me fall in love with dental hygiene all over again. First, I'd like to give you a little backstory. As I mentioned just a minute ago, I've been in hygiene for 20 years. And though I love what I do, my body was starting to break down. Not only was I in pain physically, but mentally I was frustrated. I felt I could do better than the standard scrape, polish, and reappoint, only to have my patients return with no improvements from 6 months ago. My aha moment was when I was introduced to GBT with airflow technology. GBT, guided biofilm therapy for short, it's an 8-step protocol that helps patients improve their oral hygiene with an emphasis on education and utilization of a more minimally invasive approach. The 8 steps are: number 1, assess. This is how I see where the patient presents today. I always do a thorough head, neck, and oral cancer screening. It's very important. I know what has been done in their mouth, any suspicious area, gingival health, and yes, I do probe every patient at every appointment. I also take intraoral photographs with my mouthwatch camera. I love the images this produces. They're super clear and sharp, and the camera itself is super easy to use. Step 2 is disclose. I like to use two-tone by Young. It lets me see where the patient's plaque removal skills are strong and where they need improvement. If the biofilm presents as pink, it's been there about 24 to 48 hours. When it presents as purple, we know that the biofilm has matured and now it's shifted to a more acidic and inflammatory type of biofilm. By disclosing every patient at every appointment, I shift the accountability of their oral health back to them in a way that doesn't make them feel like I'm nagging. How many of us have heard that before? The patient is more engaged and accepting of ideal suggestions. Disclosing leads right into motivation. Step 3. This is where I get to show all of my patients my amazing Burst products. I show patients how to properly utilize technique and be most effective in their home care routine. How to wrap floss. I fit them with interdental brushes and explain how awesome the Burst lineup is. I also utilize microscopy. I take a small sample of their plaque, place it on a slide, and look at the sample under the microscope. I can identify several types of bacteria and note how active the slide is. Then I share my findings with the patient on my flat screen. Talk about a motivator. Now comes the fun part. Step 4 is biofilm removal with the Airflow Max handpiece. Because I work with aerosols on every patient, it's always important that I have my patients do a 30-second swish with Closis. Closis is my preferred mouthwash and it has been proven to kill harmful bacteria within 10 seconds of swishing, and it doesn't burn or foam up like some others do. Because high volume suction is recommended for any aerosol generating procedures, I have several different options that I can choose from depending on how the patient can tolerate each one. I always use some type of retractor. I prefer this one. It's called the Comfort View retractor, and it's by Premier. I like the Comfort View because it's autoclavable, so I'm not producing as much landfill waste as I would with other disposable types. Currently, I'm using the Aerosol Assist with high volume evacuation system. Not only does it catch the aerosols, but it also allows me to use a saliva ejector to pull up any of the extra water so the patient doesn't feel like they're drowning. I also have a second high volume suction on my ASI cart, so I can utilize the relief system on the opposite side of the mouth if needed. Fortunately, the newly designed Airflow Max handpiece not only reduces aerosols, but is ergonomically correct for the provider and super gentle for the patient. By using an erythritol powder combined with pressurized water, I'm able to blast away that biofilm, leaving the tooth surface extremely clean, but not damaged like traditional polishers and abrasive pastes can and will do. Step 5 is the PerioFlow. I use this in areas where pockets are 5 millimeters or more. I'm able to reach up to 10 millimeters below the gum line and blast away harmful biofilm on the root surface while leaving important cementum unharmed. Also newly designed is this slim, flexible plastic guide or tip that fits nicely into those deeper pockets and hard to reach furcations. Step 6 is utilization of the Piezon PS instrument. The instrument actually has a brain inside of it, so it picks up what type of surface you're deriding and will gear accordingly, up for heavy tenacious calculus or down for fragile cementum. So it's very adaptable in between the teeth and below the gum line. And did I mention that all three, Airflow, PerioFlow, and Piezon, utilize warm water? So it's extremely comfortable for the patient. Step 7 is a final check for residual biofilm. We make sure that the deposit is fully removed, which makes it much easier for the doc to come in to diagnose cavities and trouble spots now that the teeth are super clean and free of debris. And then the last step is your recall recommendation. I'm finding that patients are much more apt to schedule more frequently because they enjoy the experience so much, and I've been able to educate them so that they understand how important good oral hygiene is to overall health. Now I know what you're thinking, 8 steps, every single patient, we don't have time for that. I thought that too, but now I'm finding that my instrumentation time is shorter, leaving more time to educate and explain ideal treatment, all while gaining further trust from our patients. I could go on and on about the benefits of guided biofilm therapy, but I have a few more things to show you. My software system is tab 32. I really liked the interface, and it included everything that I needed. They are my clearinghouse, my charting platform, my notes, and my referral system. And it's all cloud-based, so I don't need a bulky server in the office. I am laser certified, and currently I'm using the Picasso Clario laser by AMD. I'm using the laser therapy for bacterial reduction therapy in deeper pockets where I am finding pesky virulent bacteria. Here's my microscope. Like most hygienists, I'm a super science nerd, so I love using this one on every patient. You'd be surprised at the things you'd find on the microscope slide. I have a water distiller because all of my equipment takes distilled water, and it helps me reduce the plastic water jug waste. So this is my space. I really wanted it to be a calm environment so that patients can come in and feel welcome and cozy, and it helps with the stigma of a scary dental office. I filled it with some of my favorite things, both old and new, and amazing quotes that inspire me every day. I I hope you enjoyed the tour of my little office in Maine, and more importantly, I hope it inspires you to try something new and fall in love with our profession all over again. If you have any questions or want to learn more about any of the things I showed you today, please feel free to reach out to me at pam@searsmontsmiles.com. Keep bursting, my friends.